everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about how to overcome our shyness when it comes to talking to our patients. This video for me is actually quite personal because when I was a student, I was quite shy and quite timid and I was just nervous to talk to my patients. So if you're watching this because that's how you feel, just know that I felt that way too once upon a time and you can get through it and you can overcome it. So the first thing I wanted to point out is being shy is completely normal. It is normal to be uncomfortable in an unfamiliar situation with a bunch of strangers, right? Because that's what clinicals are, right? You'll show up to clinical, you'll be at a hospital you've never been to before, you'll have doctors and nurses you don't know, you'll have patients, of course, you won't know them. So it's going to be uncomfortable at first. That's normal. Everybody expects you to be shy at that point. That's okay. But some things you can do to kind of overcome that, the first of which is smile. So always start with a smile and go into it with a positive attitude, like today's going to be great and I'm going to learn something new. Eye contact. Now, eye contact is not always culturally appropriate, so you kind of need to use your best judgment with this one, but most people do like eye contact. So when you provide eye contact with your patient, it makes you look respectable and trustworthy and confident. So practice your eye contact. Starting conversations. So be the one to initiate with your patient. And a really easy way to do that is to introduce yourself and then say what's going to be happening. So you'll walk into the room. Good morning, Mr. Johnson. I'm Andrea and I'm going to be your nurse. Today we are going to be placing a Foley catheter, right? So you've started the conversation. You said who you were and what you're going to be doing, and then things will snowball from there. You want to show real interest in your patients, and you can do this by using active listening. So listen to their stories, especially if you're in your first clinical and you're going to be doing really thorough health histories and things like that on your patients. They're going to be telling you a lot of information. So show genuine interest. Let them know that you actually care about them. Be prepared. So before you enter the room, before you even see the patient, you should have some information about the patient. So you should get some sort of handoff report and you should review their chart. So you need to know stuff about them before you even meet them. Practice talking to familiar and unfamiliar people. This is actually going to really help you with your shyness. So familiar people might be your friends or family, people you know, right? Unfamiliar people, start slow. Start with people in your class. Like you know them because they're in your class, but you're not really friends with them, right? You're not close with them. Those are good people to learn how to talk to because once you get comfortable talking to those people, then you're going to be more comfortable talking to strangers. And by strangers, I mean patients. Stay with the patient. Don't hide. So maybe you're in there, you're doing all the things you need to do, and you're done, right? And then what do students do? They go and hide in the conference room or they hide at the nurse's station. Don't do that. Get to know your patients. A lot of times they'll appreciate the company. And you'll learn more about them and you're going to understand more about what's going on with them and it's actually going to help you in school. So talk to your patients, really get to know them. Don't hide from them. Find a role model and mimic them. This is kind of one of those like fake it till you make it kind of things, right? So find a role model, so like a really good nurse or your instructor and see how they handle situations and then copy them until you feel comfortable to kind of do your own thing. You want to work on your confidence because a lot of times our shyness comes from a lack of confidence. And I do have a full video on how to be confident in nursing school, so I'll put that in the description box. And then the final thing is use it. Use your shyness to your advantage. Shy people tend to be better listeners, so better at that active listening, more observant, so more likely to see things that are different about their patients, and then they help make patients feel more at ease. Especially if your patient is also a shy person, right? So that's going to help make them feel more comfortable. So if you're thinking, I don't think I can do this, I'm too shy to be a nurse, it's too scary, you're not. You're not too shy to be a nurse. You can do it. It's not that scary. All you need to do is practice and get more comfortable. I hope you found this video helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.